Hello and welcome. I'm An Jung-hyun for Heart to Heart. Hair loss or baldness can be a very stressful personal problem, and more we're seeing people suffering from this problem regardless of their gender or age. It is also an expensive problem to treat, and it can also affect one's social life. Well, how can we better deal with this problem, or better yet, how can we prevent it? Let's talk about that with the visiting Executive Director of the International Association of Trichologists. Please welcome Mr. David Salinger. Hello, pleasure to meet you. You have the Korean way of bowing. Well, it's certainly nice to have you with us, and I'm sure the topic today is going to be of interest to a lot of people. Now, I understand you're here for a conference and some training camp, isn't that right?
That's right. Mm-hmm. Yes, it goes back to last September when I first came to Korea to lecture, and an organisation here, the Korean Scalp Health Association, asked if they could translate our trichology course into Korean with a view to training, obviously, students here. Mm-hmm. And part of the agreement was that I would come when necessary to give clinical training to the students where they'd see the hair and scalp problems and go through everything. So
what kind of hair and scalp does a trichologist have? Healthy?
Yes, it has to be healthy. If they're going bald, then they can't be a trichologist.
Is that right? Ah, I see. And what about Korean people's hair? Have you had a chance to sort of see?
Yes, I mean, I'd say the problems are very similar to what we see in other countries. I don't think they're a lot different. But no, we've been very fortunate at the college we're at. We've had a lot of people come in with different hair loss problems. So it's been really good for the students, and hopefully we've been able to help the people.
So tell us, first of all, what is the International Association of Trichologists? What does it do?
Yeah, it's a non-profit corporation that was established in 1974 in California. At about that time, we were developing a course in trichology at the University of Southern California, and it took a couple of years to develop. There was a group of us, and the idea was that books could be used either in a college setting, or students could study by correspondence and then come together for their clinical training. So the association was initially established to really train the students. Once the university had finished developing the course, it was given to the International Association of Trichologists, and since then we've been training students initially in America, and then Australia, and then many other countries since then.
So are there a lot of students who want to be trained in this field?
There are a lot, and it's certainly increasing. So we've had a lot of interest, certainly from India at the moment and Korea. Many countries, it's become more and more popular.
And what does a trichologist do exactly?
We mainly deal with hair and scalp problems. So believe it or not, trichologists will see a lot more women than men with problems. Any type of hair loss, whether it be general hair loss or bald patches, hair breakage, scaly problems on the scalp such as psoriasis, so anything to do with the hair and scalp, that's what we would specialise in and try and get to the cause of the problem.
So you're kind of like a hair and scalp doctor?
Yeah, that's right.
And you actually cure people if they have problems?
Yes, we certainly try to pinpoint the cause of the problem, and often once you correct the cause, then the hair will get back to normal.
Oh, and you're saying you get more women who come to you with problems?
I think, I mean, one reason for that is because of the cycle and the periods that women experience. So quite a common cause of hair loss, for example, is iron deficiency, which women would suffer a lot more than men. I also think in many countries women do a lot more than men. So often women, you know, looking after the house, bringing up the children, often working, whereas men just go to work. So I think often they've got a lot more pressure on them as well.
Okay. Now, whilst you've been here, you conducted some training courses and also gave a lecture on the topic, Trichology is Science. What did you speak about?
Well, I spoke about all the different types of hair loss and scalp problems, and again trying to go into the causes, about the influence of sex hormones on the hair and skin, because they certainly have a very big influence, and also the increase in what we call autoimmune problems, which again there's been a big increase in those sorts of problems on the scalp.
We're seeing some video footage right now, and the last person we saw was someone who was suffering from
probably
baldness.
looked like the genetic thinning.
Yeah. Thinning. Okay. Yeah. So You said that Korean people's hair is quite similar to what you would see in other countries as well. And are we seeing this problem growing all over the world too?
I think that there has been a big increase in hair loss. I think definitely it is. One reason, again, particularly in women, we're getting a lot more younger women, both here in Korea and other countries, who are getting what we would call the genetic type of thinning. And one reason for the big increase, I think, is the birth control pill. Because a lot of birth control pills have a male hormonal influence on the hair, which can then lead to this sort of thinning. So that has been a big increase.
So it's the male hormone in a woman that causes hair thinning and hair loss.
That's right. But it could be just the normal levels of male hormones. For example, a lot of women after menopause will get some thinning there, but their male hormones would be perfectly normal. But you need those normal levels to influence the hair.
I seem to remember reading this one article a long time ago about how Indians don't have baldness.
I think, again, for genetic reasons, as long as they don't intermarry, that they haven't got the genetics that, say, Caucasian people will have for the genetic baldness.
I see. And what about Korean then? Obviously, there are.
We have seen a lot, I say, at the college these past couple of weeks. There have been a lot of both men and women, yes, who've certainly come in with the genetic type of hair loss. Now, by genetic, with men, recession at the front, thinning on the top, which can lead to baldness, whereas women, it's usually just a slight thinning, which doesn't lead to baldness, but certainly can be quite obvious to other people.
Well, apparently, according to recent estimates, about 25% of the Korean population are in need of some sort of scalp and hair treatment. Would you say that's pretty much the same number seen elsewhere in the world too?
Yes, I think it is. I mean, you know, that could obviously include treating the hair itself, you know, if the hair feels dry or it needs conditioning. So they may not necessarily have hair loss, but certainly from my experience at other clinics we've run, yes, I think the percentage certainly is increasing. And certainly during their lives, most people will suffer some type of hair loss, even if it's temporary. You know, for example, after having a baby, it's not unusual to get a temporary hair loss 2 or 3 months after having the baby, which goes on for a couple of months and then just corrects itself.
I mean, I obviously lose hair when I wash my hair or brush my hair. How much hair would I have to lose in order to start being concerned?
I mean, it varies from person to person. So I think the answer is more than you normally lose. But I would say on average people would lose 70 or 80 hairs a day quite normally, which is replaced. So if they suddenly found, you know, a substantial increase, then they'd have to find out what's happening.
Well, right now, out on the market, we're seeing a lot of products that are related to scalp and hair treatment. There are soaps, shampoos that are supposed to prevent hair loss or curb hair loss. Are these effective, in your opinion?
No, they're not. I think there's unfortunately a lot of rubbish on the market. There's only ever been, certainly for genetic hair loss in men and women, there's only ever been one product which has been proven to help, you know, either slow the loss or sometimes thicken the hair. So yes, certainly most products will be a waste of time and money.
So what you need to do is get to the root of the problem and eliminate that.
Well, I think that's exactly the case. So, for example, if for female obviously is low in iron levels and that's causing the problem, once you increase the iron, then that will correct the problem.
Oh, so
that's right.
You might as well go see a specialist, a trichologist.
Well, you should do, because hopefully they can pinpoint the problem. And you don't always have to do anything. As I say, somebody might have had a very bad illness and then 3 months later get the hair loss, which will correct itself. So you don't always have to give any therapy. A lot of our job is reassurance. You know, this is what's caused the problem. You know, it will go on for a couple of months, then it will slow down. And even when you get patches of baldness, which we call the alopecia areata, you know, very often by the time I see the patient, I can see the hairs already growing back, you know, and the loss has stopped. So you don't always have to treat it, but obviously the main thing is to pinpoint what's wrong internally, and that's what has to be corrected.
Well, as the number of people suffering from this problem grows, I would imagine there's going to be growing demand for trichologists as well.
Yes, I think there is. You know, I think, with the course, I mean, we're getting, I must say, a lot more doctors actually interested in studying trichology. But at the moment, a lot of doctors just don't have the knowledge on hair and scalp problems. So it's very important for trichologists to work with doctors, you know, if we need blood tests and that sort of thing. But it certainly is very much a growing field. Another reason for that, obviously, is people have got more money. And obviously, as people have more money, they can spend it on trying to find out the cause of their problem.
So now let's talk a little bit more about why we're seeing an increase in the number of cases all around the world. First, you mentioned genetics, and we learned back in school that if either one of your parents is bald, then the son is most likely to be bald later on. Is that correct?
I think certainly with men, but put it that with sons, let's say a 50-50 chance at least, if the father has the baldness. So if the father is bald, there's a 50% chance at least that the son will inherit that. Now, we don't know what the mother's genetics are. So that's all you can say. With women, and therefore, by the way, both parents could have wonderful hair, and the son can still get the genetic baldness because he's inherited it from his mum, who doesn't show it, but she can pass on the genetics.
Right.
Now, the reason women don't show it is because their male hormones are too low to trigger the problem. With women, it's certainly quite possible for the women who can get the genetic thinning that both their parents could have wonderful hair. We feel in women it's probably a recessive trait, meaning the women do have to inherit it from both parents to show the problem.
So the male hormone plays an important role here. Does that mean then if we increase the level of female hormone in a man, say through injections or something like that, then can we prevent baldness in men?
Yes, you could do, but of course they would get feminizing effects, so it's not a viable therapy. But certainly if men were castrated at a young age, in other words, not producing male hormones, they would never lose their hair for genetic reasons. So you have to have the normal level of male hormones. You don't need excessive levels, but for men they have to have the normal levels plus the genetics to get the baldness.
Plus we have all these external reasons too, don't we, these days? Environmental pollution, stress, those can't help either.
No, I mean, stress does aggravate things. You certainly can get an increase in male hormones, for example, and corticosteroids with stress. But the other thing which we mentioned with women is the birth control pill. And because some of these pills have more of a male hormonal effect, if the women have got the genetics, but when they start on the pill, that can actually trigger the genetics. And I'm sure that's a major reason we're seeing so many more younger women who are getting the genetic thinning.
And since we're talking about stress, let's talk a little bit more about that now. Losing hair is very stressful. So you're caught in this vicious cycle. You're stressed, so you lose hair, and then you get even more stressed because you're losing hair.
Yeah, that's right. And that's why I think a very important part of a trichologist's job is to reassure the patient. Because, for example, when people have general hair loss, the hair is being replaced, so you can certainly reassure them, look, it is being replaced. So as soon as the hair slows down, it will thicken up. So the more reassurance we can give, the better, which normally we can. And once you can hopefully pinpoint, look, this is what's causing it, so we correct that problem, everything will get back to normal. So I think with the knowledge to reassure people, it does relieve a lot of the stress.
Well, in the past, I seem to remember thinking that baldness was related to middle-aged people or past middle age, but as you said earlier, we're seeing more and more younger women even suffering from this problem, and this is all due to the development of civilization, isn't it then?
Yes, I think so. I mean, as you say, the things we're using, the other, again, problem we're seeing more and more are the autoimmune problems, where a group of white blood cells actually attacks the skin or attacks the hair. And autoimmune problems can be certainly triggered by pollutions, new things we're exposed to. And the more new things we're exposed to, the more chance that that will trigger an autoimmune problem in somebody. And that's just very similar to rheumatoid arthritis, which is also on the increase.
What about hair care that women do to look good? Perming, dyeing, blow drying? That can't be too good, can it?
No, but the worst that will normally do, if it's done professionally and done well, hopefully there'd be no problems, but the worst that could happen is there might be some hair breakage. So if somebody always colours all the hair, then eventually, yes, it will damage it enough that it will break off. But usually, if it's done properly and professionally, there's no problem in doing any of those things. It might dry the hair a little, but certainly as long as the hair looks as the person wants to look, then that's fine.
And then there are all these theories that people have about hair loss too. If you wear hats too much, then you might lose hair, or I don't know, if you wash it too often, then your scalp gets dried up and you start losing hair. Are they correct? Or?
No, they're not correct.
They're not correct.
Certainly wearing hats makes no difference whatsoever. And the same with shampooing. You know, the hair that comes out when you shampoo is ready to come out. And it would have gone into the what we call the falling out stage actually 3 months before it falls out. So whether you shampoo once a day or once a week doesn't make any difference at all.
So now let's talk about ways to keep our scalp healthy so that we can prevent hair thinning and hair loss. I once read somewhere that for hair loss there is no complete cure.
No, well, I think that's true because we're normally talking about genetic hair loss when even though there are a couple of therapies now that can help, they're certainly not 100%. But obviously for any other type of hair loss, then usually you can pinpoint the problem and cure it if you want, so you can get the hair back. What was the other thing you were asking about?
Preventing hair loss, some ways to prevent it.
If we forget about genetic hair loss for now, your hair very much reflects your health. So obviously number one is to try and stay healthy, which means eating properly, eating all the food groups. The hair is mainly protein, so you need to have some source of protein with every meal. With women, iron is very important, so ideally they should either be eating some red meat or eating supplements with iron in them. But certainly the minerals are also very critical, so you need to eat properly, hopefully be absorbing the food properly, because that's another problem we find is that malabsorption has been on the increase. People eat and just not absorbing the foods, they get bloated and so on. And then again, having hopefully a stress-free lifestyle, which usually with most people means moving to Australia where you don't have the stress.
Now, if you go visit a trichologist, then can you get a diagnosis as to why you are losing hair?
Yes, well, usually you can. That's usually in the first consultation, that's what we will certainly try to do, just both by looking at the scalp, because if it's genetic, it's very obvious by looking at the scalp, but also talking to the person, looking for other signs and symptoms, maybe having some blood tests run, and you can also have the hair analysed for minerals. So the hair, for example, is the best way to measure things like lead and mercury and arsenic and cadmium, so the toxics. It's the best way to measure them. So certainly one could do blood tests on the hair, but talking to the person, getting information is hopefully the main way you will know what's causing the problem.
So if necessary, then one can take, for example, iron pills.
That's right.
If it is iron deficiency that is causing the hair loss.
Or low blood sugar can be a cause of it. So again, improving your diet, cutting out sugary stuff can make a difference. Thyroid problems obviously are quite easy to correct. So yes, but certainly when it's mineral deficiencies, it's a very simple thing to correct.
So I guess the easiest way to prevent hair loss is to make sure that your scalp is kept healthy. And you suggested eating right. What are some cosmetics? Can we use cosmetics to keep our scalp healthy? Or
shampooing daily. I think I always advise that when possible, I think it's always good to shampoo daily, obviously with a shampoo that can be used every day. For women or men who are chemically treating the hair, obviously conditioners can help the hair just look and feel better. But I wouldn't think there's nothing as such you can do on the scalp that's going to prevent hair loss, because as I say, usually it's more internal than external that causes the hair loss. Tight hairstyles, for example, in America, a lot of the black Americans, who are braiding their hair and leaving it like that often for many weeks, and even here probably in Korea where people get extensions which are too tight, that can certainly lead to patches of hair loss as well. So I think if you're going to have your hair in ponytails or braids, try not to have it too tight, because that can cause a problem.
If you go to a hair salon, they always recommend you to get this hair and scalp treatment, which is supposed to make your scalp healthier and your hair shine better.
Well, I think certainly we can make the scalp healthier, no doubt about that. We've all got microorganisms on the scalp, and certainly people have oily scalps. The yeast on the scalp can multiply. So I'm sure the treatments are aimed at, just keeping the microorganisms in check so they don't cause itching and flaking and that sort of thing.
In my case, I personally suffer from seasonal changes, or my scalp suffers from seasonal changes. Sometimes it'll be very dry depending on the weather outside. If there's a dry warning out by the Weather Bureau, then my scalp gets very dry.
No, it is a big influence. I mean, obviously, particularly humidity, and particularly on the hair. You know, in a humid climate, you'll often find people's hair will become more curly, for example, whereas when they go to a dry climate, it becomes straighter. So it's, yeah, the weather's certainly a big influence.
Now, for people who are suffering from hair loss because of genetic reasons, then there's no hope for them?
I wouldn't say there's no hope. There's a couple of treatments that can be of benefit, and the earlier one tries them, the better. One being an internal drug, Propecia, the other being an external thing called Rogaine or Regaine. So they can certainly help. Also for men, you know, or women in fact, if they've got a lot of thinning or baldness, they can have hair transplanted, which can look very good. So that, you know, it's expensive, but it certainly can look very good. So I would say they're probably the only things they can do as far as genetic hair loss goes. With women, it's more a matter of, if you want, counteracting the male hormones, even though they might be normal. Now, so there are hormonal treatments that women with genetic thinning can do. Also, natural estrogens I find very good. You know, so you don't have to go to hormones. There are natural things that can be used as well.
Such as?
Well, the dong quai, you know, the herbs, the dong quai, the black cohosh, red clover. So these are things that give natural female hormones, which I certainly use a lot of in my clinics and can be very effective. But both with men and women, whatever helps with genetic thinning, they have to keep on the therapy, unfortunately, because if they stop the therapy, then they will lose any benefits.
You know, there are a lot of products out on the market that deal with hair and scalp health. What are some ways in which we can select the products that are right for us?
Well, I'd have to say probably then, you know, seek your advice of a hairdresser. I mean, I think that would be the best thing, because I think, you know, a good hairdresser will be able to help you rather than choosing yourself. But again, when it comes to products for hair loss, I think unfortunately there's a lot of fraud as far as that goes, and I think people need to be very, very wary of trying anything for hair loss.
Well, in the UK recently there was this whole movement of not washing your hair. I guess they're just being silly then.
Yes, I mean, well, I think people in England have always not washed their hair very much anyway. But yes, I think it will not benefit your scalp or hair. So it shouldn't make much difference to the hair, but certainly the scalp, if it gets oily, you know, it will get itchy and so on. So I certainly feel the more you shampoo, the better for the scalp.
But then if your scalp is really dry, then you probably shouldn't shampoo all that much.
No, but if you use a shampoo that's formulated for everyday use,
I see.
then you wouldn't have a problem. Now again, you know, dry flaky scalp can obviously be due to other reasons. So we do see a lot of people with flaky scalps due to psoriasis, for example, which is an autoimmune problem. So then you have to obviously take therapies that will help that get back to normal.
Now the students who you met this time, the Korean students, what did they want to know the most?
Well, I think certainly hair loss, they're interested in the causes of hair loss. But basically, I mean, the students, I must say, are fantastic, and I love, you know, the Korean students. They're certainly beautiful people, and they really want to know as much as they can. And I must say, with the present group, I mean, they've studied really hard. I mean, their knowledge is very good. But anything to do with the hair and scalp hair breakage, you know, the internal causes, they know, or they certainly want to know, and they've studied very hard.
Now, another common problem that a lot of women face is losing the lustrous, I don't know, losing the shine in your hair, having brittle hair that just breaks or things like that. How do we take care of that then?
Well, again, there's different reasons. So you obviously have to eliminate external reasons. Are they over drying the hair, for example, too much, or using chemicals on the hair too much? Again, with changes in waviness or straightness, that often relates to sex hormones. So again, you'll often find when women either go through puberty or menopause, they do get the change in the shape of the hair for that reason. We do get women who feel the scalp is very sensitive, again, in that area, also influenced by sex hormones. So you have to, again, counteract the male hormones. Even though they might be normal, they can have a bad effect on the hair and skin.
So the best thing to do is to go see a hair expert then.
Well, it is. So hopefully they can tell you everything you need to do and shouldn't be doing.
Now, my last question to you, can you tell our viewers why they need to pay attention to their hair and scalp?
The main reason I would say is because it's one of the signs of a health problem, and it can be the first sign of a health problem. So, for example, if somebody is developing a thyroid problem, the hair loss may be the very first thing that happens before the other signs and symptoms occur. So from my point of view, it's a very good indicator of health.
Okay, well, thank you very much for telling us all about hair and scalp, and I hope you will have a pleasant stay here in
Yes, thank
Korea.
you very
I hope
much.
you'll come
Thank you for
back.
having me.
Well, there you go. You heard it from the trichologist himself. Hair is the first indication of the overall health, and if you are experiencing any of these problems, hope you're going to go see an hair expert about them. And overall, I hope this program has been helpful for all of you who wanted to know about hair and scalp. That is it for this edition of Heart to Heart. I'll be back with more next time.